At a recent press conference, Mayor Daley and city officials offered steps residents can follow to protect themselves against the H1N1 virus and other influenzas as the fall flu season approaches. Here are highlights of the August 25th news conference.
As we all know, in the beginning of another school year, many children in Chicago public schools, year-round schools, started school on August 4th. The remainder of our schools will be open Tuesday, September 8th. To help them kick off the new school year, Ron Human and I just attended the Chicago Public Schools Annual Administrators Conference to welcome back school leaders, review last year's accomplishments, and of course set priorities for the years ahead. I reminded our school leaders that investing in our young people is one of the most important ways we can give back to our city because they represent all of our future. One of the most important things that we need to accomplish this year is to keep our students healthy and well so we can keep their progress going in the schools. That means protecting all of us from influenza, both the regular seasonal flu and the new strain called swine flu. Schools are on the front line of our prevention efforts. We're here today to talk about our efforts to protect the public health, just as important to remind all Chicagoans of the simple steps they can take to protect themselves and, of course, their families. Even before Chicago saw its first case, H1N1, last spring, we fully understood that although this new strain of flu is a serious challenge which must be addressed responsibly, no one needs to be alarmed or to be in panic. Since that time, we have been able to review the U.S. Center for Disease Control proposed guidelines, use them to further develop our strategy to protect residents this fall, when the number of flu cases are expected to increase. Working together with the Chicago Department of Public Health, Chicago Public Schools, Department of Family and Support Services, and the Office of Emergency Management and Communications are prepared to offer steps everyone can and should take to protect themselves and their families, both from the regular seasonal flu and the new strain of pandemic flu. These steps include new guidelines for parents who have children suffering with flu-like symptoms, as well as how students can keep up with their schoolwork if they are at home for several days recovering from illness. The Chicago Public Schools and Health Department have also collaborated on a more sophisticated system to track attendance data as well as illness patterns so that the school closures are the last possible resort. In accordance with the guidelines set by the federal government, our goal is to minimize disruption in the classroom environment, which also helps minimize disruption for parents and, of course, their employers as well. The Department of Family and Support Services will also ask its child care early Head Start sites to remind all parents of preventive measures of H1N1. Notify the Department of Public Health with any unusual number of absences among children or staff. The Health Department will also offer free seasonal flu shots at 45 one-day flu clinics from September 14th, October 9th throughout the city. We fully believe that working together preventive steps will help protect people against disease transmission, protect everyone at school as well as in the larger community. Our city department's heads can give more detail about what we are doing. And let me say this, in a city of 3 million people, we can't prevent every case of flu. But we can plan, we can prepare, and we can be ready as possible for the upcoming flu season, and we are. The best thing we all can do is to stay alert, stay aware. Thank you. Terry?
Sorry. Thank you, Mr. Mayor. Thank you for joining us to talk about an important public health issue. I'm Dr. Terry Mason, Commissioner of the Chicago Department of Public Health. Influenza is something all of us should take seriously. Federal health authorities estimate that in an average year in the United States, the flu and its complications cause about 36,000 deaths and over 200,000 hospitalizations. The new strain of swine flu that reached Chicago last April is still with us and is still causing illness, although at a level greatly reduced from what we saw in the spring. That said, we do anticipate a second wave of swine flu cases in the months to come, locally, regionally, and nationally. No one can predict exactly when the numbers will start to rise or how long the second wave will last, or how many cases and fatalities there will be, or if some people will be affected more than others. Yet we do know that in the first wave of the swine flu pandemic in Chicago, the fatality rate was very low. We also know that the disease had a disproportionately negative impact on pregnant women and children. The median age of all known cases in the city is 12 years old. While we can't prevent every case of influenza in the city, as the mayor said, there are steps we can take and are taking to help all Chicagoans protect themselves and their families, both from the regular seasonal flu and the new strain of swine flu. Specifically, we are advising all Chicagoans to get a seasonal flu vaccination. To get a seasonal flu shot, contact your doctor or other health provider. If you do not have a doctor, call 311 to find a City of Chicago vaccination site near you. From September 14th to October 9th, the city will offer seasonal flu shots at no charge at 45 one-day clinics. And additionally, a number of pharmacies and related businesses are or will soon be offering seasonal flu vaccinations. This year, there will be plenty of seasonal flu vaccine, and shots will be easy to get. Most of that has already started to roll into the city already, and there are people getting those shots now. We are encouraging all Chicagoans to make an extra effort to cover coughs, sneezes, wash hands regularly with soap and water, and stay home from work or school if they have influenza-like symptoms, coughing, sore throat, and a fever. We are asking all parents of young children to teach these good health habits to their sons and their daughters, and to plan ahead and make home care arrangements for their children on days when they are ill and should be kept at home from school or daycare. Regarding the new swine flu vaccine, when it arrives, probably mid-October, the Chicago Department of Public Health will take the lead to ensure that it is distributed quickly, efficiently, and accord with federal CDC guidelines. It will be distributed to hospitals, clinics, and other healthcare facilities to ensure that health workers are vaccinated. We will also distribute it to retail pharmacies, occupational health centers, and colleges and universities. The health department will also make shots available at various sites across the city for people who do not have a doctor or whose family doctor does not have swine flu vaccine. Finally, I want to say what I've said since we saw the first case of swine flu in Chicago last spring. This situation is a cause for concern, but not alarm. When it comes to fighting the flu, common sense is truly our best defense. Thank you.
Thank you. Good afternoon. I'd like to echo what has already been stated here today, and that is underscoring the importance of being prepared. Collectively, our efforts and a sense of urgency to raise the awareness of the virus has no doubt given our schools and our communities information and education that is both useful and lasting. We know from experience that a solid communications process is critical, and we will continue to share information with our school communities, the CDPH, and other stakeholders on a daily basis. Tracking data on student absences and analyzing that data will give school officials and the Chicago Department of Public Health real-time information by school and by grade for any patterns of absences that should be cause for concern. Once again, we'll be notifying our school principals, teachers, and parents beginning next week with a whole new round of communications on the measures that we're taking to begin precautionary measures against the virus and the spread of the germs. Like Dr. Mason stated, common sense measures like covering the cough and washing hands regularly with soap are strongly encouraged. All of our schools will be stocked with disposable thermometers, hand sanitizers, and Kleenex. And our facilities teams are inspecting schools to ensure that hot water is available in every school. The CDC has revised its guidelines to school closures. Closing schools will not be the recommended practice this school year. Instead, we will monitor student attendance and communicate that data to the Chicago Department of Public Health on a daily basis. A practice that's just as important is our ability to ensure there is minimal disruption to student learning in the event that students miss school due to the flu illness or any other unexpected emergency. CPS has been piloting a program known as Parent Portal. It's a way for parents to communicate with teachers so they can monitor students' grades, attendance, homework, and assignments course syllabi all over the internet. Once the account is established, parents and guardians can manage their child's student information from any computer with internet access. Not only can parents communicate with teachers by direct messaging, but they can also receive real-time information about the academic-based notifications which they define for their child. Since the tool became available, more than 22,000 parents have logged on to the site. Families with a computer at home can access that portal at home, and others can access it through the Chicago Public Library or anywhere else there is access. We urge parents to go to www.cps.edu and click on the, quote, I want to check my child's grade section, where they can get additional information about this great tool. Finally, we want to take the opportunity to applaud our principals, teachers, and school administrators for handling the matter last spring without panic and instead with caution and care. We will continue to remain vigilant in our daily monitoring so that all of our students are safe and healthy. Thank you.
Good morning. I'm Mary Ellen Karen, the Commissioner of the Department of Family and Support Services. We provide a range of both direct and indirect services that serve Chicago residents beginning at birth through their senior years. Our department administers direct services through 6 community service centers and 18 senior centers. We also administer resources to approximately 350 delegate agencies who collectively operate more than 1,000 program sites. We have services that are child care, early Head Start, out-of-school time programs, youth employment, human services, homeless services, and senior services. The department has been in contact with the health department since the initial onset of the H1N1 virus. We receive communication updates and share prevention and reporting information with our staff, our 350 delegate agencies, and our communities. This week, we will be sending out letters to all our child care, early Head Start, and Head Start sites to be sent home with children in order to remind parents of the preventative measures for H1N1. In the letter, we also ask our sites to contact both the health department and our department if the rates of absences meet 5% or more, and if they observe any unusual numbers of absences among staff. We have made the health department info prevention materials available at all our community service centers and the senior centers. We continue to encourage our staff, delegate agencies, and various publics to be vigilant and exercise preventive measures as outlined by the Chicago Department of Health. We will continue to be in regular contact with the health department to identify any demographic trends related to the H1N1 flu so that we can react appropriately. Thank you.